and Affordable Care Act was passed by Congress. And ever since the Supreme Court gave the states a choice regarding Medicaid expansion, I've been asked on numerous occasions, how will West Virginia proceed? And every time I've said, we'll do what's right for the people of our state after we look at the benefits and the costs of expansion. We've been diligent in our decision-making process, analyzing the Supreme Court ruling, asking tough questions, and obtaining as much information as possible. And although we may not agree with every provision of ACA, I must make a decision for West Virginia based on the circumstances presented to me. At the end of the day, we have weighed the options and believe expanding Medicaid is the best choice for West Virginia. I am therefore directing DHHR to draft state plan amendments for the expansion of Medicaid, authorization of co-pays, and expanded use of managed care. We anticipate expansion will allow us to provide insurance coverage to approximately 91,500 working West Virginians, significantly reducing the number of uninsured. If we made the decision not to expand, the cost would be significant for our families, for our businesses, and the health of our state. Our tax dollars would pour into other states that do expand. Our businesses would be subject to additional taxes, and our hospitals would lose significant financial resources. In a state where heart disease, diabetes, and other chronic health conditions occur at levels far too high, this expansion has the potential to provide meaningful improvements to the health of our citizens, to help maintain federal support of existing assistance programs, open the door to more economic development rooted in health care, and lessen the cost of health care as a whole, saving taxpayer dollars and keeping insurance premiums and co-pays lower. These are costs associated with this expansion. There are costs associated with this expansion. However, over the first 3 years of expansion, for $15 million in state resources, we will draw down over $1.3 billion federal dollars. Over the long term, we anticipate that expansion will cost approximately $65 million per year in state dollars to draw down over $550 million federal dollars each year. A decision to expand today, however, does not end our efforts. We must carefully watch federal actions. If the program becomes unsustainable, particularly after 3 years, where the federal government changes its promised funding allocations, we must be prepared to take action to protect our state. Indeed, in expanding Medicaid, we must maintain 3 fundamental missions. We must continue to be fiscally responsible. We must emphasize personal responsibility. We must ensure that DHHR operates efficiently and effectively and improve outcomes while controlling costs. Fiscal responsibility is something I've worked hard to do since my days as a freshman back in the House of Delegates in 1975. We believe that there are savings from current programs providing funding for uncompensated care, match rates for other federal programs, savings from our Public Works report that can be used to cover a significant portion of expansion costs. Second, we must make sure that individuals take control of their lives. Improper utilization of emergency rooms and healthcare services drive costs up. Using mechanisms like co-pays, we will be asking our Medicaid recipients to take control of their lives and think about the health choices that they make. We will continue to pursue concepts like managed care. And finally, with our allies in the United States Senate and House in Washington, Senator, we will negotiate with the federal government to give West Virginia the most flexibility possible to control our own destiny.